My name is Chloe Oller, and this is my Healthy People 2030 project over pregnancy and childbirth. In this presentation, I will be discussing the objective of reducing preterm births and the goal of how to achieve preventing pregnancy complications and maternal deaths and improve women's health before, during, and after pregnancy. What is a preterm birth? A baby that is born before 37 weeks is considered a preemie or premature. Premature babies can sometimes have health issues that can affect them for the rest of their lives. Labor occurs when the uterus tightens and the cervix thins out, allowing the baby to travel through the birth canal. General information and the incidence and prevalence rate. The rate of preterm births are getting worse. In 2019, 10.2% of births were preterm. In 2018, 10% of live births were preterm. Within a year, the rate of preterm births increased by 0.2%. 1 in 10 babies are born prematurely. 500,000 babies a year are born prematurely. Causes of preterm labor. The cause of preterm labor is mostly unknown. Some potential known causes are infections, vaginal bleeding, hormone changes, or stretching of the uterus. This could be caused by being pregnant with more than one baby, a large baby, or too much amniotic fluid. Women at risk for having preterm labor. Women who smoke, being under 20 years of age or over 35, long-term illness, using illegal drugs, abnormally shaped uterus, cervix not able to stay closed, stress, having a previous preterm birth, being African American, placenta that separates from the uterus early, placenta that stays in an abnormal position, an early break of the amniotic sac around the baby, birth defects in the baby, problem with fetal growth, more than one baby in the womb. How to prevent preterm labor medically. Your doctor can prescribe you tocolytic medicines which help slow down or stop contractions, corticosteroids. These are used to help further develop and mature the lungs of a baby, considering sometimes preterm babies struggle to breathe on their own. Cervical circlage. This is a procedure done to stitch the cervix closed, mainly when the cervix is weak and unable to stay closed on its own. Antibiotics if the preterm labor is caused by infection, or in extreme cases, your doctor might have to go ahead and deliver the baby if the treatments don't work or puts you and or the baby's health at risk. This could cause a potential need for a C-section. How to prevent preterm labor at home. See your doctor early and regularly to keep up with your prenatal care. Try to take care and manage any pre-existing health problems like diabetes or high blood pressure. Don't smoke, drink, or take any illegal drugs. Try to maintain a healthy diet with different varieties. Gain a healthy amount of weight. Reduce the stress in your life. Protect yourself from diseases, and make sure to wash your hands. Overall health recommendation. Increase women's access to preconception care services. Identify women at risk for preterm delivery and provide access to effective preventative treatments. Discourage deliveries that aren't medically necessary, especially before 39 weeks. Prevent unintended pregnancies and achieve optimal birth spacing. Encourage people to transfer a single embryo rather than multiple embryos for pregnancy achieved through assisted reproductive technology. These are my references. Kids' Health, A Ticking Uterus, How Nurses Can Identify, Treat, and Prevent Preterm Labor, Stanford Children's Health, and the U.S. Department of Health and Human Services.